Welcome to Living Healthy Chicago. I'm Jane Klaus. Today we're talking about how important it is to seek help if a health challenge is slowing you down. The sooner you get to work with your medical team, the sooner you can get back to all the things you love to do. And that's the message this man would agree with. So let's hear what it took for him to get back on the move after struggling with arthritis. About 4 years ago, James Dukeshire started dealing with pain in his left knee that quickly began to limit his mobility.
It was really an excruciating pain. I couldn't, even I got out of bed in the morning, I couldn't get my balance. Going up and down the stairs was a real challenge. It was just terrible. My quality of life was totally destroyed.
James initially tried to manage the pain on his own.
I was staying on aspirins every day, and for a while it wasn't helping at all anymore. That's why I decided I had to get something done.
So he went to the doctor and was diagnosed with osteoarthritis.
He did a CAT scan on my knee. Cartilage was hardly anything left. And he says, "Jim, how are you walking like this?" He told me, "We've got to get you into surgery."
So James was scheduled for a knee replacement. And James's doctor is the one to ask about knee replacements. Joining us to give us some insight is Dr. Nam. Dr. Nam, first, why would somebody require a knee replacement?
Really, a knee replacement is the end of the line procedure. That's really when they've tried everything else and nothing else is working. And they're at the point where they want pain relief and they want to get back to their activities of daily living. So what we'll do is actually remove the arthritis or shave off the arthritis off the ends of the bones. And really, we're just putting metal caps on the end of the femur and on the end of the tibia and a little plastic liner in between, which then makes the knee nice and smooth.
The cool thing about this knee surgery is that you used a robot to do it. So explain that a little bit.
With a robotic knee replacement, we get a CT scan of the knee before the surgery. We can see the patient's knee in 3 dimensions. We can see where the bone spurs are. The robot is able to see the CT scan, and we can make a plan in 3 dimensions for that patient's knee, very specific. We then bring in the robotic assisted arm that helps us make our cuts. The thought process is that we actually have to do a lot less with a robotic knee in terms of the amount of bone that we cut, in terms of the amount of soft tissue releasing and balancing. And the belief is that this should improve outcomes, decrease variability, and also improve the speed of recovery.
Dr. Nam, what made James a good candidate for this procedure?
He had end of the line arthritis, severe stiffness of the knee, pain on a daily basis. James's diagnosis was osteoarthritis, and it was simply wear and tear. By far the most common indication for having a knee replacement is osteoarthritis.
The surgery went well, and with the help of rehab, James began to feel better.
I walk so much better now, you wouldn't believe. I feel fantastic.
His knee replacement is doing great. He's able to walk without any assistance, has really no limp.
What do you hope that we all learn from James's story about knee replacement?
If you've tried things before and they're not working for you and your knee is still limiting your activities, I would seek out a surgeon and say, "Hey, am I a candidate for this procedure? Because I'm simply not happy with my quality of life."
Experiencing pain, go and get it done. I'm doing just about everything I've done before. Get your quality of life back again. It's like a new day. It's going to make all the difference in the world.
So if you like this video and want more living healthy, just subscribe to our channel.